profession, I should say, has its own uniform law with conduct rules that are embedded within that uniform law. And in terms of psychosocial hazard, those conduct rules don't really address anything but discrimination, sexual harassment, and workplace bullying. Anything else, so in management of workload, things like that, they're not sort of regulated in that regard as well. The Legal Services Board and Commissioner in Victoria really is driving the need for there to be sort of changes and systemic changes. And she's even pointed towards, this is Fiona McLeay, has pointed towards regulation, in regard to ensuring the psychological health and safety of employers as well. Otherwise, I think even she said we're going to be sitting here in the next 10 years, nothing's really going to have changed. She also looks at the fact that, in other sort of disciplines and industries, they've been much better able to manage, the psychological health and safety, but law sort of seems to have, sort of stagnated and not really, there's been any changes. In terms of consequences, well, we see, practitioners burning out, Jason, and the burnout rate is just escalating. That sense of exhaustion, cynicism, that reduced self-efficacy as well. I talked about that NAS study that was done in 2012, which, showed a lot of the drivers from the profession. There's sort of anecdotal evidence that sort of points towards the fact that by the 5-year mark, lawyers, early lawyers will have left 50% of lawyers will have left the profession by the 5-year mark. So, really looking at that as well is definitely some of the reasons why we're seeing, especially with our early lawyers, if the factors are not managed for them, we're seeing them sort of just drop out of the profession altogether. And it's really difficult when you're trying to, fledge a really robust and long career as well, when we're seeing this attrition rate escalating. So, yeah, look, I mean, it can, as I said, with burnout, we can see lots of other things such as, manifestation of mental health concerns as well.